Okay, so I think we're live now. Um, and so just as a heads up to the audience, I'm chatting today with Joseph. Joseph signed up through my blog, JawHacks.com, for a one-on-one chat with me at a 50% discount under the condition that it would be recorded and then uploaded to YouTube. So Joseph, thanks a lot. And
Yeah, thanks for having me.
yeah, let's just jump into it. Let me know what you want to talk about and how I can help you.
Cool, yeah. I've been kind of following this kind of space for a while, like the orthotropics, JawHacks kind of stuff for a while. I've watched lots of your videos, especially your interviews with the, forget the dentists and surgeons' names or whatever. But
Dr. Ting.
Dr. Ting, that's right. And I just, have always noticed, there's something wrong, and what do I do? So I guess I'll try to give you a brief history. Whenever I was in middle school, I had braces, I think from 8th grade, and then it was only supposed to be 18 months, something like that. And the reason was I had my top right canine, so my number 6 tooth, came in way high, right? It's just all the other teeth were lined up. This is I don't know if you call that a buck tooth or whatever. It just came in really, really, really up here, up in high in my gum line. So then well, we could pull it, and I'm like, that's a pretty noticeable tooth to pull. And at the time, I was in 8th grade, and this is I'm 38 now, so this is in the 90s, right? I just decided, no, I want to have all my teeth, of course. So then they got braces up there, and they pulled it apart, and then pulled that one down. Then I had a mouthful of braces just to get everything straight. And then about a year and a month or two into my treatment with my orthodontist unfortunately passed away. So the guy that took over his practice said, oh, we got to redo everything. What this guy was doing wasn't right. So then I had braces. He moved stuff around a little bit more. I don't know. I was young. I didn't really even know what was going on. And I ended up having braces for a full 3 years. Damn. So a lot of my braces, I remember for a significant portion of that time, just like the typical braces, I was using the rubber bands, right? And then the rubber bands pull from bottom to up here, right? So I'm thinking what happened to me was a large amount of that long, especially through a long period of my developmental years, really just screwed my whole upper maxilla. So right now, I have a pretty narrow palate, like I'm sure a lot of viewers are familiar with, and also it's very recessed. I guess I can kind of just give you a little bit of idea.
Sure.
At least from. So this is like a normal bite, and I'm going to try to have decent posture.
Mm-hmm.
Like that on the side, and then I don't know.
Yeah, you want to rotate and show us the other side?
Sure. I don't know if that's good or if you want me to.
No, that's good. Yeah, now just the posture looks decent enough. There, yep. Is that a more natural posture for you?
No, this is me trying to have good posture. So this is whenever I'm slouching and sitting, my posture, I definitely have the nerd neck, the forward head posture, which is I know bad. I'm slowly trying to correct it over the years, but obviously there's not a whole lot working.
It's hard to fix that with jaws is underdeveloped as some of us are. Yeah, can we take a look at your smile and then see the roof of your mouth?
Yeah, so it actually, I'll just show you now, but I did have a DNA appliance. I've had that for about a year, so just pushing on teeth, like you're saying. I was hoping that I might be able to get a little bit of septum, or not septum, but the suture release in my maxilla, but I don't think that happened at all. But yeah, so.
Mm-hmm.
And I don't know if you can see that well. I don't really have good light in here.
It's okay. It's decent enough. Yeah, can you lean back like this?
Oh, yeah.
Mm-hmm. Hold that there for a couple of seconds. You're perfect, just like that. Mm-hmm. Mm-hmm. Super high and vaulted. Yeah, that's good.
Yeah.
Yeah, and then can we see that smile one more time like this?
Yeah.
Mm-hmm. Mm-hmm. And then release the lips so that I can just see the corridors. Yeah, so I'm seeing the buccal corridors as well, the so-called black triangles.
So this is actually significantly improved. So I did do the DNA treatment, and I'm still. I actually just got a second appliance. So I don't know. I haven't measured.
A second
And I don't know
DNA
how it's
appliance?
Yeah, I mean, I just got it, but I don't think I'm going to go wider because my teeth are already starting to tip a little bit on the molars, and I don't think there's much more I can do unless I do an MSE or double jaw surgery or something like that to actually just move the bone out, because I don't think my teeth will move much more without actual maxilla expansion.
I think that's a wise caution that you're demonstrating.
Yeah.
Before we move on, can we also take a look at your tongue to see if the potential tongue tie? Yeah. So tip of the tongue behind the upper front teeth, and then open as wide as you can, like this. Yeah. So, definitely not the end of the world, but
yeah, it's a little bit, but
I would say it's moderate, and you're probably going to want to have that looked at some point as part of your treatment.
Yeah.
Not the end of the world though, but yeah, I would say definitely could use a release done correctly by someone like Dr. Zaghi at some point.
So pretty much. After that orthodontic treatment in my middle school / high school years for those 3 years, everything, I had a decent smile, whatever, but yeah, very narrow, pretty recessed. Over the years, had some symptom. Obviously, got the developed for neck posture. I think I had that since I was young, though. Just never improved. Snored mildly through my early adult years through now. I did get a sleep study done. That's the first, I guess, thing that I did first. I just started, reading stuff about this 2-3 years ago, I'd say. So then I got a sleep study done because I was worried about, sleep apnea and all the, health risks associated with that. Because I do snore, my wife complains about it. But it's not too many apnea episodes. Whenever I got my sleep study results back, I think they said it was 6 apneas an hour, which I think, and I don't know if it's per hour or however the scale goes, but 0 to 5, not worth thinking about. 6 to 15 is mild, is what I remember him saying, and then more than 15, you pretty much should treat it with something, and then more than 35 or something like that is severe, and that's your. But mine was 6, so he said basically if he doesn't recommend me do anything, obviously it's cosmetic, he could recommend certain things to help with there's other mouth guards, those kinds of things, right? But he doesn't think that I need a CPAP, which I would not be opposed to using a CPAP. I'm married. I wear ridiculous headgear all night. I don't really care, but it doesn't interfere in my personal life or anything. But it's something I'd rather not do if I could have other ways of resolving it. I mean, I'm perfectly fine wearing a CPAP for the rest of my life, but at this point I'm thinking something's got to move just even while I'm awake. You know what I mean? It's the quality of breathing that I've heard that people have from either an MSE or surgery of some sort. It seems to be way worth it. I'm still relatively young, so I think I can get a lot of benefit out of it over the next 100 years of my life, we'll say.
Mm-hmm.
But
I love that.
Yeah, I don't know. So what I did is I got a DNA. One of the there's I don't want to mention his name, just whatever. But very well respected. He wrote a couple books, and I had a consultation with him, and he's like, "Yeah, I recommend you do this DNA appliance." And I mean, I do think that it actually improves stuff. I just don't think that there's much more that I can get out of it. I was saying. So this is my old appliance, and you can see how. I guess you can't really see how far it's gone. I don't know if you could. My focus probably isn't that great.
Sure. Well, when you started, were there no gaps there between the 3 pieces?
Right. Yeah. That was completely flush before.
Yeah. Can you explain how that basically works?
Yeah. So basically, I put this in, and there's a front gear and a side gear, so you can kind of see how it tees off there. Mm-hmm. There's not really good focus.
It's okay. It's clear enough.
Basically, these things move side to side, and this thing just moves forward with a screw. And that screw, pretty much on average, and it would change every 8 weeks or so that I had an appointment. On average, I would be turning this one once and turning this one once, and each one turn is about 1/4 of a millimeter. So
And then what's that thing in the back, that the arm that sort of kicks out?
Yeah, so that arm is that actually goes in the roof of your mouth, and you are, as much as possible, supposed to be pushing kind of like the back part of your tongue, like the part of your tongue where that would make contact, pushing that up against that.
Can we
And,
see
you know,
that
that's
again?
kind of, yeah.
Yeah. Huh. So that thing just
So it has
sits
a
there
little
at the
roller
roof of
on
your
there.
mouth?
Yeah, so that sits there at the roof of your mouth, and basically you kind of just force that up against there as best you can. It's not super comfortable, but it's not uncomfortable, like once you get used to it. And the whole point is just to kind of force this whole mechanism into the roof of your mouth better, just to help the expansion along, because if you just have this sitting in there, it could kind of like start to bow downwards or inwards a little bit.
Does
At
that
least
thing
it's
fit in your mouth
kind of what I
now?
understand. This one does. Actually, I have the newer one here too.
Could you put that in and then
The
show
new
us
one
what-
fits.
Yeah, can
a
we
lot
see what
better.
it looks like in your mouth?
So this is the new one. This is the old one.
Okay, very similar.
So I can just put this new one in. It's just very slightly opened up on this one. So
Damn, that thing's
Yeah,
beefy,
and-
huh? And then can we see what the
this
so-
one is a lot more robust.
Yeah, and can I see what the roof of your mouth looks like with that thing in?
Oh sure.
Yeah, with the appliance in. Yeah, just lean right back. Damn, man. So that thing basically eats up all of your oral volume.
Yeah.
Right?
So if I'm wearing this, and I'm supposed to wear it like 16 hours a day, if possible, and I'm usually, especially at the beginning of my treatment, I was pretty decent with that. Then way before, when I was done with this appliance and getting this appliance, nothing's moving in a month or two it took to actually, it doesn't take that long to make the second appliance, but in that time I'm not expanding anymore, otherwise this won't fit, right? So, and that it ended up being 2 months because of scheduling, and they had to make it and all this stuff, and I went on vacation, all this stuff. It took like 2 months to get the second one, but in that 2 months I wasn't really wearing it all that often. But yeah, it takes up a lot of my oral volume, so it's very difficult to do anything like close to mewing, because I just can't fit my tongue in the roof of my mouth at all. I mean, I
Exactly.
can barely fit the tongue in the roof of my mouth fully, generally. So I mean, I can kind of show you a little bit like how much it'll go up there now, and that's even with a little bit of more room because my teeth are wider.
Yeah, sure. Yeah. So your tongue is just, bursting at the seams there.
Yeah.
And does it get scalloped when you, after mewing? Do the edges of your tongue have
Because of my
teeth
teeth,
marks?
yeah, the teeth imprints, yeah.
Yeah, of
Yeah,
course.
it has my whole life. I never really realized, but obviously, having a lot of just mouth breathing over the years too. I mean, I didn't realize until like 3-4 years ago how terrible mouth breathing is for you, and I didn't even realize I did it most of the time. Completely unconscious to that. And looking back, I do remember some instances where I would just be sitting at home and like playing a video game, or just sitting there playing the piano, something, focusing on something, and I know my posture was just like this. You
Yeah.
know, the
Just
whole time, and
total
that's so
open mouth.
bad.
Open mouth,
Right,
nerd
yeah.
neck.
Complete mouth breather. Yeah. So that's pretty much it. There's also the lower appliance I didn't show you, but it's not really a whole lot to talk about for that one. It just goes.
Do you
to the
have that
side.
on hand? Can we take a quick look at that?
Yeah.
I've seen those before.
This is. I didn't even get the new one. He said I don't even need the new one because my bottom teeth are pretty much lining up with my upper teeth as it is.
Can we see?
Yeah.
Sure. Throw that in.
Doesn't actually even fit anymore.
Okay,
But,
why? Because you took it out for a while and then it kind of collapsed.
I took it
back
out for
in?
a while and I haven't really used it, but I mean, it's not really that necessary. I mean, my teeth line up without it. I think eventually, after this treatment's done, I will end up getting something like the Invisalign just to make everything meet up a little bit better. Right now, this is trying to mostly just move everything out. It needs more leverage. It needs this beefy thing or this beefy thing to move it out. Move my molars wider as possible, as far as possible, and then move my front teeth forward. So just give me more oral volume. I mean, overall, sorry. Go ahead.
Yeah, so I was going to say, so where are you at now, and what are you thinking about proceeding, and how can I help you specifically? What did you want to, go over with me?
I guess the biggest thing is I think that it's not just having more intermolar volume and all this stuff. I think I need a lot more forward advancement because I think that I am just so recessed, you know.
Can we see from the side one more time? Yeah. Yeah. Yeah, so I'm specifically I'm looking at your nasolabial angle. You know, the angle between your nose and your upper lip is obtuse. And then your chin is, you know, there's essentially no visible mandible when you hold decent posture.
Yeah, and I'm not a chubby guy. I'm a pretty slender dude. So like having this double chin is like really. I'm like, why do I have a double chin? It doesn't make sense as well. It's because my chin is so far back.
Yeah, you're a thin dude with a double chin and sleep apnea.
Yeah, exactly. So
you don't fit the conventional wisdom when it comes to this stuff.
Right. Yeah. I mean, I'm 5'11", 160. So yeah, shouldn't have a double chin.
Right.
And the other point of it, I did get a face mask.
Oh.
But I don't think this is doing anything. I usually wear it at night, and I also mouth tape. I got a pretty ridiculous scenario going on. It was breathe right strips, put the appliance in my mouth, put this on, rubber bands, and mouth tape, just because I feel I do sleep better and I don't breathe through my mouth. It also disturbs the appliance less if I just have my mouth closed the whole time.
So you connect the face mask to the appliance?
Yeah. It's just pretty much like yours did. I think I saw whenever you had it. Yours. I don't know if that was post MSE suture split when you used yours. I think I remember seeing one of your videos.
I used to connect mine. Well, I was connecting mine to the TAD screws of the MSE. So
okay, yeah, it's very similar. This just connects on the hooks right above the canines. So
okay,
it hooks right here and then pulls forward.
Okay. So your appliance has some face mask hooks built into it. Yeah, my MSE did as well. Actually, now that you mention it, I forgot about that.
Yeah, so I really don't think it's doing much. I mean, I can feel that it's pulling a little bit. Unfortunately, the way that this mechanism works, and I don't know what your experience was when you were trying to sleep with it, because I would maybe wear it, like on a Saturday, I would wear it a little bit in the morning, but I kind of just stopped. If this is pulling, it's leveraging on your forehead, and it's leveraging on your chin. Yeah. With someone like me, who I can't even keep my mouth closed during the day, let alone at night, right? I mean, I have to make a conscious effort just to, have good posture and mew and keep my tongue on the roof of my mouth and keep my molars touching but not clenching, right? But if I'm wearing this at night, all it does, it does pull a little bit on my, it just pushes my chin down is what it does, because it tries to shorten this distance, and I just end up just sleeping like this. Like, it doesn't seem to really be capable of doing its intended effect. And I tried chin straps. I don't really have much of a chin to leverage onto with chin straps. I think I think it's worth trying. I just don't think it's really working for me.
Yeah, that face mask is a piss poor design, and that's why people are using the crane, or they're using the bow, or the Grummons face mask, something that doesn't leverage, the chin to pull the maxilla forward.
And I haven't seen all those other different designs, and I was kind of like thinking, like, I have a mechanical engineer degree, and I was like, oh, what if I make something that leverages like around like the back of your head or something? I don't know if they actually have stuff like that, but just pushing here doesn't make sense to me.
No, it doesn't. No, they have face masks that push off the neck. They have face masks that push off the chest. Yeah. And they have face masks that push off of the zygomas. So that would be, this would be the Grummons mask that pushes off the mid-face, which is also not ideal. And then the bow pushes off.
Right, because that's all connected, right?
Correct. The bow pushes off of the sternum and the forehead, and then the crane is essentially a neck brace with a arm off of it, and then it, the force goes back to the neck. So but the worst of all of these is definitely the one you just demonstrated, which, everyone who uses a face mask already has a recessed chin, so pushing that backward even more is definitely not going in the right direction.
Yeah. So I guess that's the extent of my history, I guess, just for context. But the reason I want to talk to you was mostly just like I've been doing a little bit of research, not very thorough, but in terms of like the next step, because I think at the very least the MSE would be appropriate just because of the high vaulted narrow maxilla. But I'm thinking just because of how far in, and I remember I think with one of your interviews you were talking like even with an MSE and a face mask done ideally, you're not going to get that much forward growth. You're not going to you're not going to be able to fix that problem, right?
No,
you're
even
not. With like optimal perfect scenario. So I think it's almost 100% that I'm probably going to need something like double jaw surgery if I actually want to fix my major symptoms, which were the sleep apnea, just the difficulty breathing, the snoring, all those kinds of things. I just want to be able to have stand up tall, just like a lot of us. We want to be able to stand up tall, breathe, be able to breathe deeply and sleep well, and not have breathing issues the rest of my life.
I hear you, brother. Yeah, man. I'm 100% with you, and the issues you're describing are very common for people that I speak with. They're issues that I dealt with, to not as severe a degree as you, but to some degree. And yeah, no, I hear you loud and clear that you want to do something about this, and that having tried the DNA, you see the limits of toothborne expanders. They do provide a marginal increase in intraoral volume in virtue of the fact that they essentially move the teeth mostly, maybe perhaps stretch the midpalatal suture to a degree, but mostly what they're doing is they're moving the teeth in the alveolar bone and sort of cheating their way toward increased intraoral volume that ultimately has very real limits, as you're discovering, because you get to a point where you're like, shit, man, if I crank this thing anymore, my teeth are going to be tipped out, and or the teeth can become very painful, or you start to get gum loss on the inside of your teeth because of the plastic rubbing up against that sensitive part of your gums. So yeah, I had a similar experience as you, where I expanded with this thing for a long time, and then eventually my teeth ended up like this. My molars especially ended up tipped out. My gums were inflamed and painful. I couldn't even chew food because it was so painful. And at that point I was like, this isn't a sustainable approach to, and by the way, having reached that point in my toothborne expansion, I was like, wow, I am not anywhere near where I was hoping to be in terms of results. So yeah, I hit that same wall, which is one of the things that ultimately led me into the MSE.
Yeah. So I guess for someone like me, do you think it's, in some of your videos recently, it seems like you're more an advocate for trying to do MSE before I would try to do double jaw surgery. If I should just probably consult with both an MSE practitioner and a jaw surgeon and see what they think. Obviously, they're going to come up with different kinds of plans. But if you think that there's no disadvantage of doing MSE first, before I would try to do like was it the MMA?
MMA, yeah, mandibular maxillary advancement.
Yeah.
Yeah, so just at a glance, looking at you, I'm thinking you're absolutely a candidate for MMA. I think that, so your underdevelopment is three-dimensional. Of course it is, right? Like, when the jaws don't grow properly, they don't just not grow properly in one dimension, like front, back, or left, right. Like, it's three-dimensional, right? So yeah, I'm seeing pretty significant AP recession, right? So you're recessed, which makes you definitely a candidate for double jaw surgery, at a glance. And then also super high and vaulted, so an MSE would definitely be, called for as well. Now, whether or not, you can skip the MSE entirely and just go right for the double jaw surgery, considering that we kind of both agree that you'll need that eventually, is a separate question. And we can talk about that if you'd like. But yeah, at a glance, I'm thinking MSE, MMA, which is sort of like shit, man, like a lot of the people I talk to, we end up just sort of thinking, like, I confirm something they already knew from watching my channel, which is, yeah, you need to get wider and you need to come forward in counterclockwise as well. And the way to do that effectively and efficiently and safely is with MSE followed by double jaw surgery. Now, some guys or gals are a little bit less recessed than you, and their issues are a little bit less severe than yours. They're what I call fence cases. I don't consider you a fence case. I think you're I mean, you're already in treatment, right? Like, you've already decided, okay, this is serious enough where I have to invest in my time and effort and energy into fixing it, and you've done that with the DNA. And you're not a fence case. So, you know, yeah, I think MSE, MMA would be a reasonable approach.
Yeah.
What?
And I guess sorry, go ahead.
No, you go ahead. Go ahead.
I was just going to say, to that end, I mean, you know, being in the Northern Virginia area, DC, it's, you know, there are maxillary oral surgeons in this area. I don't know, I guess, and I know you haven't had double jaw surgery, but like the best way of navigating, because there's going to be options. There's going to be some that are more for cosmetic, some are more for, you know, trauma. You know, I'm sure there's ways of seeking out an oral surgeon that would most you know, be suited for the kind of work I'm doing. I mean, I'd be willing to travel if I need to. I mean, I don't know how that works with like post-operation treatment and follow-ups and that kind of thing. I mean, I'm only like 4 hours from New York. If I got to go to New York, it's not a big deal for me. I'll just take a day off of work and I'm fine.
Yeah, DC is a good launching pad, relatively speaking. New York, LA are the best. Also, the Pacific Northwest is great as well because there's some all-stars up there as well. But DC is not bad. So yeah, generally, so I have someone in mind for you already. Her name is Liliana Calkins. She's an orthodontist in your area, and we can look up her details in a minute. But generally, the approach is this. You find an orthodontist. The orthodontist is the hard part. The MSE provider is the hard part. Anyone who's having oral surgery is going to need to work with an orthodontist as part of that process. So you need an orthodontist anyway. Okay, so surgeons, they're not all the same, and don't hear me as saying that they are, but they're more all the same than orthodontists are. Finding an airway-focused orthodontist is more rare than finding an so-called airway-focused orthodontic surgeon. All orthodontic surgeons are trained in MMA surgery. It's you know, a big part of what they do. Not all orthodontists are trained to think in terms of making things bigger, and certainly not all orthodontists know how to use an MSE. Okay, so the approach is this: you find the orthodontist who can provide you with MSE, and then you ask them who they work with in terms of an orthodontic surgeon. Because a big part of getting your treatment right is finding a team that works together and that has an established relationship. So you don't want to, getting two doctors who don't know each other to work together is like trying to herd cats. It's a futile endeavor. So what you want to do is you want to find a team that already work together and then just sort of enter into their pipeline. So yeah, for you, I'm thinking Liliana Calkins can get you going in terms of potentially an MSE, or she might just say, hey, you know, I think you should just work with the surgeon and just forget the MSE. I don't know. That's possible. But I would be inclined to, because my understanding is that Liliana is an all-star. She's pretty good. Everyone in the DC area who I speak with, I send to her, and I haven't heard any negative feedback yet. She definitely is an MSE provider. She's definitely able to handle, and she definitely works with surgeons and refers people out to surgery quite a bit, as far as I know. Never actually met her, never spoke with her, but this is just what I hear through the grapevine. So, yeah, my approach, if I were you, meet with Liliana Calkins, get her opinion, and then go from there.
Oh, yeah. I mean, that sounds great. Yeah, I was trying to think. because just like Google Maps or something like that. I was like, surgeon, and it's like all these different things, and I like go to their websites, and I was like, shopping around like this does not seem like a good way. Obviously, once you go there and you can talk to them, I'm sure a lot of these consultations probably aren't cheap or free, just because they have to probably do a whole analysis of your head. I mean, like whenever I went to get my DNA plans, they do a whole, they do like what's the little standing up MRI kind of thing? I forget what it's called.
CBCT.
Yeah, I think, yeah. So they did that whole thing and like came up with a plan and everything and all these documents and everything. He's like, this is what we plan to do. And I was like, yeah. But yeah, trying to do that with multiple surgeons in this area without any kind of like basis of like, so yeah, okay. So you're saying start with an orthodontist that's specifically is into airway issues as opposed to just like, I guess cosmetic. I mean, obviously cosmetic is an added bonus, but like I said, I'm married.
Yeah, no.
My wife is stuck with me.
Yeah, you're not trying to
it'd be
impress
nice
anyone.
to have better form, but
Although,
form is
hey
function.
man, it never hurts to stay on your A game, even if you're already in a relationship, right?
Yeah, of course.
No, look,
We'll
I
make
think
everybody happy.
someone coming from your point of view is the perfect, you're in a great spot because you're thinking of this in terms of function, and any aesthetic improvement that you get is just going to be icing on the cake.
Yeah, exactly.
Someone like you is always going to come out happier than someone who's coming into it primarily for aesthetics, because aesthetics is way more subjective and it's way trickier. Okay, the subjective component of this type of stuff can be a little bit more chaotic, especially with MSE. You never quite know whether someone's going to be happy with the way they look after. I mean, generally people do, and objectively making your arch wider, expanding your midface a little bit, that's going to make you look better. But it's not that straightforward with MSE, actually. Things can go a little haywire from an aesthetic point of view. But generally, it's going to make you look better. And generally, double jaw surgery, by counterclockwise rotating you and by bringing both jaws up and forward, that's going to look better too. But for you, if you're just seeing any potential aesthetic gains as a bonus, perfect. Stay there, man, because that's a great place to be. That's kind of where I was coming from all of this from. And it's nice. Like, I guess I look a little different after the MSE in a good way. Some people don't think so, but I think most generally think that. Oh man, sometimes the comments, man. But like, you can't focus on that, right? Like,
yeah.
it's a brick wall with 1,000 bricks, and 2 of the bricks might be negative, right? They might be a little off. Focus on the 998 good ones instead of the 2 bad ones, right?
Yeah.
But you're guaranteed to get a functional improvement and probably an aesthetic improvement as well coming out of MSE and double jaw surgery, without a doubt.
Yeah. Cool, yeah. I mean, I appreciate that. I mean, like you were saying, it's kind of just confirming what I already suspected pretty much, but it's nice to have that. So I guess I had a list of other kind of like things here.
Yeah, have you heard of Liliana Calkins, by the way?
I have not, no. Let me check.
Yeah, so next step, go see her, and then if you're not happy with how that goes, then maybe reach out to me again, and I can put you in touch with someone in the New York area, at least for orthodontics, because up there is where my provider is, Ilya Lipkin, and where there's a bunch of other really solid orthodontists like Zubad Nuaz, and some other people in that area.
Cool, yeah. Yeah, I mean, like I said, it's not that far from me if I have to go up there, but, who knows.
Yeah.
Cool. All right. We actually did cover a lot of my notes. The one thing I had, so I do have it's a slightly deviated septum. I don't know. I can breathe out of my both nostrils, but much less. Usually, if I do get any congestion at all, my left one's just closed. Like there's no getting it open. And a lot often whenever I wake up, it's just closed, and then after an hour or two, it'll clear up or whatever. I don't know if you've had experience with dealing with people, and I've read a whole bunch of different things. People like cutting out dairy or something like that, just to try to reduce inflammation to help with nasal breathing all the time. I mean, I know that there's a bunch of information out there. I don't know if you have any opinions on that. I mean, I just try to remove allergens from my house and keep stuff clean, and then I have an air purifier and that kind of stuff, but I don't know if that's really helped.
Yeah, so I think the most significant thing you can do to improve your nasal breathing is going to be to just split your maxilla and increase the volume of your nose by expanding your nasal floor. So, do that and then sort of see where you stand. But stepping back for a second, 1,000-foot view, when you're someone like yourself or like me who has a condition like sleep disordered breathing, or you already have underdeveloped structure that's predisposing you to be ill constantly, you have to improve every possible aspect of your health and well-being all at the same time. So yes, I think diet matters. I'm on a pretty strict diet myself, so I'm on like basically a 70% carnivore diet.
I've been kind of similar as well. Probably like 2017, I started at least going low carb. I did keto pretty hardcore for like a year and a half. I'm kind of off of it and just doing low carb, cycling a little bit here and there. But and then I still have dairy. I cut out dairy for a good part of time. I didn't see any improvements. I've had dairy my whole life. I don't think I have any issues with it, so I just brought it back in.
Yeah,
but still, minimizing the sugars. But yeah, I think it's huge. I did, supplementation mostly just with vitamin D, K2, and like vitamin C and that kind of stuff. Maybe a little bit of magnesium.
Mm-hmm.
But yeah, for the most part, I think if I'm having discipline, the diet thing I think is okay for me. Having bone broth, I was thinking the bone broth would help with this whole maybe my suture splitting for this DNA thing. It's not splitting though, so. Or even slowly moving out, it's not doing anything. But I imagine if I would have double jaw surgery, I'd probably want to have bone broth, especially in the recovery plan or whatever.
Just a side note about DNA splitting the suture. I mean, you'll see if you get your MSE how much the MSE with its 4 10-millimeter screws is going to struggle to split that suture. Okay, like 4 screws screwed into the roof of your mouth into solid bone is going to struggle to break that suture. So to think that you could do that to think that something like this pushing on your teeth is going to break that same suture is just ridiculous.
Yeah.
It just doesn't. The teeth are obviously going to give out before the suture does, given how strong the suture is as demonstrated by MSE, and it struggles to split the suture. But back to your original question about other things you can do to improve your breathing. So air quality is key. Do you have animals in the house?
No, not yet. We probably will, but...
Well, if you do, just get something hypoallergenic, right? Like get a dog that has hair, not fur.
Yeah.
I just stayed at my buddy's house in Smyrna, Georgia, outside of Atlanta, my buddy Cameron, and he has a dog that had hair rather than fur, so it didn't shed, and it was like, I didn't even know the dog was in the house. Meanwhile, it's this giant beast of a dog, and it's just like having nothing at all in terms of allergens. Meanwhile, a little cat with fur like throws me for a loop, and I immediately get stuffed up and start to get like, my throat gets backed up and I start getting phlegmy as soon as as there's a furry animal in the house. And with diet, probably ideally there'll be no dairy, but my experience with diet is that you try to eliminate as much as possible, and then your body kind of naturally finds an equilibrium between healthy and cheating, where sustainably over the next 60 years, you're probably not really going to be able to cut this thing out. So just try to minimize it, and then sort of do the best you can with it. I mean, after 10 years of experimenting with dieting, that's kind of where I've landed. I find that if I just fill up, so I eat twice a day, and I always start my meal with a heavy portion of meat and fat, basically. So a fatty cut of meat, for example, like a ribeye.
Yeah, I'm a big fan of I'm a huge fan of ribeye. I was just about to say that,
Hell yeah.
Ribeye and broccoli.
Oh, dude, ribeye and broccoli did you say ribeye and broccoli?
Yeah.
Yeah, beef and broccoli,
right? That's my go-to meal.
Yeah. Did you ever listen to Immortal Technique?
No.
He's this rapper from the 2000s. He was a badass dude. But he had this one track called Beef and Broccoli. And he was onto something. But when you start your meal off with a freaking 12 or 14 or even a 16-ounce ribeye, there's not much room left after that for junk.
Yeah, yeah.
So just start your meal with the good stuff. You'll fill up most of what's there, and then after that, you can kind of eat whatever you want, and you're only gonna be able to fit so much cheese or pastry or shit in after you get the steak down.
Yeah. My one weakness in that respect has been those. I don't know if you ever had those keto ice creams. They're like low carb. It's like a whole pint of ice cream. It only has like 6 grams of carbs in it because it's full of like erythritol instead of sugar.
Oh, dude, yeah. I'm an expert.
Too much.
I'm an expert in keto snacks and all the alt sugars. So on the surface, it seems like a free lunch. Like, oh my God, this tastes amazing, and there's and it's not increasing my blood sugar, essentially, right? But what I found with those is there's no free lunch in anything in life. Yeah. And the way you feel the negative of the erythritols and the monk fruit extracts and the xylitols and the aspartames, it happens on the back end. So in the large intestine, they don't get absorbed. I mean, that's the whole point, is that the body doesn't absorb them, right? But then they sit in your intestines as undigested food, and it gives horrible fucking gas. Like, if you just feel, no, it's nasty.
Yeah. So I've had that whenever I overdo the erythritol specifically.
Yeah.
The bad ones are sucralose and aspartame. Those are bad for your gut bacteria. But like the erythritol, I got like these from Costco, like these basically erythritol M&Ms is what they are really. Yeah. But I only need to have like one handful of those. Sure. And I'm completely like, my night's over.
Oh, really?
I'm like, I can't go in public. Yeah. I mean, it doesn't make me feel bad. It's just that if I'm around people, I'll just be embarrassed the rest of the day.
Totally. Totally.
So,
oh, yeah.
But yeah.
Yeah.
No, I want to go down the whole rabbit hole for diet. I mean, I think we're kind of on the same page for the most part. I mean, I appreciate all the work you do. I think you're doing a great job as a patient advocate. I mean, I appreciate, your advice to me specifically. I saw a couple of your videos recently about your, just some things that you've been experimenting with for your workouts and everything, especially for like your neck and shoulder strengthening and everything. That's another one of my symptoms I just wanted to notice in case any other viewers are interested. I do, and I'm not super consistent, but I do some strength training. I have like a gym in my basement. I try to just do basic barbell stuff. I've been kind of like a skinny guy my whole life. I do bench press, deadlift, squats, rows, that kind of stuff.
Fuck
just
yeah.
a pretty basic beginner kind of thing. But the one thing I have noticed, and I'm pretty particular about having good form so I don't hurt myself, because I'm not a like, let's run our head into the wall kind of football player kind of guy. Like, I just want to be healthier, right? I'm very averse to anything like close to contact sports. I'm like very cowardly in that way, if you want to put it. So I was like, I don't want to hurt myself with deadlifts. So I watched tens of hours of videos on proper deadlift form even before I was like pulling 2 plates, right? So in that regard, I thought I was doing everything perfectly well for overhead presses, right? And I ended up having some shoulder pain after a while. And I was like, okay, well, I'll lower the weight, make sure I'm doing good form and everything. And I think one of the major problems that I have is whenever I really start going back into it, I keep getting shoulder impingement. And I think a lot of that is just a result of this, rounded shoulder posture, this posture, rounded shoulders. Whenever I go anything overhead, it's just your shoulder is not supposed to operate like that. Like, you really have to have good posture, and shoulders back and down, and for your shoulder to actually function properly. And I think those stabilizing muscles and everything around there is just weakened so much over the years that I really have to, I haven't actually consulted with a physical therapist, which is probably what I should do. It definitely hasn't caused any major damage. It's just, painful, and then I just stopped lifting. So yeah, it's hard to be consistent whenever you keep running into little pain things like that. But that's, another thing that this whole thing just from here down started here, and affected this, and affected this. And yeah, it's just, trying to correct one thing at a time before you can really progress, I think is the strategy and the way to go. But
yeah, man, I think you hit the nail on the head. The shoulders are probably the hardest part of a body makeover. After the facial bones comes the shoulders. because, like, I think you're exactly right. A lifetime of this makes all of the stuff that's underneath the scapula and around the scapula super weak and atrophied. And then, like, you try to have good shoulder posture, and you don't even have the muscles there to even, like, achieve the posture to begin with. So when you go to do, like, something overhead, the raw materials just aren't even there for you to even know what proper form feels like.
Yeah.
So my experience with rebuilding that whole region has been just super slow, super lightweight, super patient, and then I just got to stay on top of it, like, constantly.
Yeah, consistency, yeah.
But one thing so I do very specific exercises to target that region. So I don't do, like, I don't even use a barbell. So I basically use kettlebells and then body weight exercises. And I found that pull-ups with just a focus for perfect form, you gotta really feel the scapula when you're doing a pull-up, right? And it's almost impossible to do it. Like, you're like, oh my God, I have to engage that when I'm doing the pull-up, right?
Right.
But eventually it gets stronger and it gets better with time, right? So, like, I've been doing this for almost a year and a half now, and I would say I'm at 50% of where I want to be in terms of the ultimate position and strength of my shoulders. It's that slow of a process, right? And then another thing that's really good for getting the form of this region perfect is Turkish get-ups. Are you familiar with them?
Oh, okay, yeah. Yeah, I've seen them. I haven't really incorporated them at all, but yeah, I've seen people do them.
Yeah, Turkish get-ups are great because if your shoulders aren't perfect, the kettlebell is going to fall. So to get the kettlebell over your head, you essentially need to have a perfect, retraction.
Yeah, all the stabilizer muscles, yeah.
You got to engage the stabilizer muscles, and you got to engage everything behind and around the scapula, right? So it's deep. And it's just an objective way of making sure that you're activating the right stuff. Is just like, if you're not, the frickin' thing falls over, right? So I've been doing Turkish get-ups since early 2021, so like a year and a half now. And I do super lightweight. I started with 8 kilograms because kettlebells come in kilograms, usually not pounds. Now I'm up to 12. Super lightweight. And then the other key is, instead of holding them the regular way with, like, the bell draped behind your hand, you hold it with the bell up and then the handle.
Okay, so it's a little bit more difficult to balance everything. Yeah.
It forces you to stabilize even more. Right? So, yeah, it's all about finding exercises that force you to have the right form, and then being patient about not putting on a huge amount of body mass for the first couple of years until your core muscles, like especially the muscles around the shoulders, are at a point where you can now do something heavier that's going to put a little bit more mass on you. Yeah, so kettlebells, Turkish get-ups, Turkish get-ups, pull-ups, even push-ups, right? But focusing on your scapula, making sure you engage the scapula. Right?
Oh yeah, like pull your shoulders down.
Yeah. So here's what I tell people the key to scapula form is. So I keep my cell phone in my back pocket, right? Because I want to keep the EMF away from my nuts, right? It's just psychologically I'm more comfortable with it. It might be bullshit science, but like I don't put my phone in this pocket. I put my phone in my back pocket. Okay?
Yeah.
So what I tell people is, take your scapula and put them in your back pocket.
Yeah.
You know what I mean? Tuck. So you want to, 2 things: palms forward, right? If you just take your palms and you go like this, that kind of gets your scapula in a better position. Yeah. And then tuck them into your back pocket. And
Yeah.
You can feel a sort of engagement when you do that, and then that's the engagement that you want to maintain when you're doing exercises. And then do that for like legit a year and a half, slowly with low weight, with perfect form, and you eventually get to a point where you're starting to normalize and starting to overcome 30 or 40 years of shit shoulder posture.
Yeah.
But yeah, the shoulders are key, man, and they're really hard. And you, dude, sometimes you even see big guys, big lifters. They're fucking huge, you know. Like they're just like their chest is bulged out, but then you see their shoulders are like this.
Yeah.
You know what I mean?
Yeah, from the front angle, that makes your traps look huge, but
right.
It's not good, right?
But you really want to be more of like, you know, tuck them into the back pocket, you know?
Yeah. Yeah.
Anyway, that's my shoulders rant.
Yeah, that's cool. Yeah.
What else you got?
Yeah. That's. I mean, that's really about it. I mean, I don't know if there's anything else that you were thinking about. Yeah.
Yeah, man. I mean, shit. I could talk all day, but I mean, as long as you've got all your questions answered and you accomplished what you hope to accomplish with our time together.
Yeah, I think so. Yeah.
Yeah.
I
Do
mean,
you think
nothing else on my list? So.
You think you'll see Liliana Calkins?
Yeah. So I mean, I still have yet to talk to my.
DNA provider.
I'm overall happy with the treatment. I'm going to talk to him a little bit more and just say, hey, what do you think about this? Do you have a surgeon, or do you recommend MSE? Or I haven't talked to him about that yet. I kind of just I saw your video about like, hey, chats, and I was like, oh, you do chats, and I was like, oh yeah, sure, let's do a chat. And then before the chat, I was doing a little bit of research, and I was like, oh, all these other people are doing this, and I was like, maybe I should do that. So
he's probably going to he's probably going to talk you out of it. Or try to.
Yeah.
He's probably going to be like, "Oh, that's super invasive. Why do you want to do something so extreme?
Yeah.
Just be patient with the DNA. It'll eventually get you the results you want." Unfortunately, that's all bullshit.
Yeah.
I mean,
there's risk with surgery. I mean, a lot of the being a healthcare professional is first do no harm, right? But at the same time, like I'm here because I don't want to just be a little bit better. I want to thrive, whatever people say.
Yeah, the bottom line is that the DNA, in virtue of being in lieu of being a toothborne appliance, is not going to get you the results that you ultimately need in order to be better. It has limits.
Yeah.
The DNA is better than nothing in the hands of the right professional, but it's coming at a cost to your teeth, right? Like putting your teeth through a DNA appliance is not a totally like harmless thing. You're putting them through expansive orthodontic forces that are not ideal. Okay, so the DNA is not this minimally invasive appliance that they make it out to be. It's actually putting your teeth through the ringer to a degree, right? So he's probably going to say, "Oh, this MSE, it's extremely invasive. It's essentially surgery. Why do you want to do that?" But the reality is, even though MSE at a glance looks more invasive because it's like legit splitting your skull, right?
Yeah.
Like it seems more invasive, but actually the fact that it spares the teeth all of that orthodontic stress that something like DNA does, in a sense, makes it less invasive than the DNA.
Yeah.
So just something to keep in mind.
Yeah, for sure. A lot to think about. But for the risks associated with it, I think just finding a good surgeon and being in otherwise good health is also probably going to minimize being relatively young or whatever. I think is going to hopefully minimize the likelihood of any complications or whatever. But yeah.
Yeah, man, you seem super healthy. I mean, you're on top of your life, and your health. So I don't think you'll have any trouble recovering from surgery.
Yeah, I have a care network. My wife and also my mom's retired now, so I think I'll have the support around the house if I need to. For like 6 months to a year recovery for that kind of for full recovery, or the first month is going to be hell, but
Bro, you'll be all right.
We'll see. We'll see what they do. Yeah.
You'll be all right. If you're healthy going into surgery, you'll be all right coming out of it. But yeah, wifey and mom, that sounds pretty ideal.
Yeah.
Nice, man.
All right. Well, yeah. Thanks a lot for your time, man. Yeah.
All right,
I got
Joseph.
anything
Hey,
else?
man, I enjoyed talking, and I wish you the best of luck, and let me know what else I can do to help you out, okay? Let me know how it goes with Liliana if you get a chance to meet her.
Yeah, definitely.
All
All
right.
right, thanks, man.
Take care.
All right, you have a good one.